Hi, we have followed the Swedish COVID-19 pandemic for a while now, and we're going to continue to follow to see what kind of impact of COVID-19 on Sweden and the society. Today, we talk about this sperm shortage, and so the COVID-19 infection caused the Swedish sperm shortage, and the reason is that the potential donors for assisted pregnancy try to avoid hospital during the pandemic. That also the indication that Swedish people do practice some kind of social distance and try to prevent themselves from this COVID-19 infection. And the sperm shortage is very serious because usually people just need to wait for about 6 months, but due to the sperm shortage, they need to wait at least 30 months. And that's a really huge impact to people who like to have baby. And so in order to get this assisted pregnancy, usually you have many different approaches. And first one is for best one, I think you should get fertility treatment at the clinic. And second way is that you can get artificial insemination at home. And the third way is natural insemination, or go through unprotected sex with someone. And so here's just simple approaches. You can hear that they get sperm and then just inject sperms into vaginal or cervix, sometimes get direct into this uterine. And this ovary, they will be create some eggs, and the egg will pass through this tube. The sperm and egg are going to meet, and the sperm can fertilize the egg, then move to uterine, and then implement in the uterine, and then going to create a baby. And that's a very interesting phenomena. So to me, I have a huge concern about this so-called natural insemination, or some kind of sexual intercourse to donate this sperm. And so if you go to Facebook, you search for this, put the keyword free natural insemination, you find many people to actually offer such kind of help. So to provide free natural insemination, that means that the recipient and donor are going to have sex, and so they deliver this sperm naturally. And of course, this is the advantage of this natural insemination. And for some natural insemination, and that is look like this more natural ways to create a baby, and those feel comfortable with the idea of sex with the sperm donor, then it may be semiologic, as does not require use of syringe or artificial medical procedures. And also because it's a natural way, generally speaking, and this is superior to the hormone insemination. And so because they have potential to achieve higher rate of success than artificial insemination using a syringe. However, it does have some disadvantage of this natural insemination. And first one is the legal issue. If you choose to use sperm donor and conceive by natural insemination, then the donor will be classified as legal father, and because you know him, you know everything about donors. In the normal practice, and the donor usually is confidential. You don't know who is the donor. But in this case, because donor and recipient which have sex together, and this regardless of whether you are single, married, or in several partnership, this is disadvantage for both. And for both the recipient and also for the donor. For the recipient, it means that the sperm donor could be potentially claimed for custody rights. And for the donor, it would mean that the recipient could claim the children maintenance. And the second disadvantage is the health issues. And if the sperm donor is donated by means of natural inseminating and has donated by this method previous, then they will carry high risk of sex transmitted diseases because they have sex with many different people. It is also important to be aware that the sex transmitted disease test does not show a positive if donor has caught the disease recently. So even so, they show you the test results, but because you don't know when he has sex with other people. So in addition, donate by natural insemination is high risk for donors as they may pick up sex transmitted diseases from the recipients. So they put themselves in the risk if they donate by this natural insemination. The third important issue is the emotional. So have natural insemination may affect many people emotionally in many different ways, depend on personal circumstances. So as a single straight woman, you may feel emotional attachment to your donor if you choose natural insemination, and maybe you donor as potential father for your children. So that is challenging. As a lesbian woman, you may feel pressured and uncomfortable with the option of natural insemination, even so the intention is purely to create a baby. So if your relationship with then have natural insemination with your donor will undoubtedly be uneasy for you and will potentially put strain on your relationship, regardless of whether your partner is in agreement or not. So it's a huge burden on you. Again, this is a very interesting topic. So if you are donor or recipient of this of the sperms, will you choose this natural insemination? And that's why. And that's so. Please leave your comments on this video. So we're going to have more discussion on this and help everyone make right decision for yourself. This is nothing right or nothing wrong. You can select this natural insemination if you feel comfortable, and that's your own decision. That's you after you make decision, you should feel comfortable. And we wish you be happy and to get a nice baby. that's the talk for today. I wish to see you in my next video.